Hi. The government announced that dentists are going back to work on June the 8th. However, it may not be that safe to do so. In my 30 years of experience, we've overcome many cross-infection control problems. However, this virus is more like Legionella and was a respiratory virus, but with far deadly consequences for the general public. Just like HIV, we'll have to go along with assuming everybody has the disease. And unlike HIV, anybody can share it with anybody who's reasonably close, just by breathing. We just don't know if you're infected, not infected, or immune. But we do know lots of people come in, and we don't know how long the virus will last within the environment. And that is a concern. So whoever we see can get it. That can be you, me, my nurse, my receptionist, anybody. Do we want to take that risk? Your safety has always been our priority, and we want to maintain that. For most procedures, this is what we'll have to wear. And then we'll have to spend an hour cleaning the surgery after you've been in, just to be reasonably safe. Appointments will be prioritised to those that need them most, and the conditions will be a lot different. You'll get a phone call before you come in, and most of the details may be taken online. The vast majority of dental practices will be running at a loss, and many may well go bankrupt, so please be patient. We haven't had the support that many businesses have had throughout this pandemic. We will not know the risk until we have the evidence, and that'll be a long time coming. So in the interim, what you can do is keep your mouth clean, download the app and try to improve your scores. Save a life, sharing teeth for life.